So today we're going to talk about pap smears. So what is a pap smear? According to the Center for Disease Control, a pap smear looks for precancerous changes on the cervix that might become cervical cancer if not treated appropriately. During the test, the provider will use a speculum to view the vagina and cervix. After visual examination, the provider will use a small collection brush to collect the cells and the mucus in the cervix. The cells are then sent to the laboratory for analysis. You should start getting a pap smear at 21. If the results are normal, the provider might tell you to wait 3 years until your next one. It is okay to get this test when menstruating, but please avoid intercourse or vaginal medicines. Now, let's talk about our patient scenario. This will walk us through a scenario with a young woman, Katie, getting her first pap smear. She brings her mom, Skylar, with her for the patient interview aspect. The front desk person is Melissa, the PA is played by Jen, the PA student is played by Jamie, the medical assistant is Jenna, and the collaborating physician is Camille. Now let's get on to the scenario.
Good morning, what's your name so I could check you in today?
Hi, my name's Katie Bill.
Alright, I have you right here. Here's some paperwork to fill out, and I just wanted to let you know that you're due for pap smear today.
Great, thank you so much. Mom, you didn't tell me I was getting a pap smear. I'm nervous.
Try not to worry too much. I'm sure their provider will walk you through before the procedure.
Action.
Hi, my name is Jenna. I'm going to be the medical assistant today. How are we feeling?
I'm a bit nervous.
That's okay. That's totally understandable. A lot of patients feel that way before their first pap smear. But Jen is really great. You'll be in great hands. She'll answer any questions that you have. I'm just going to start off today by taking some vital signs. Is that all right?
Yeah.
Okay. So we're going to put this around her arm. Alright, so I'm just going to go through some of your medical history now, okay? So can you tell me when your last period was?
October 3rd through the 8th.
Okay. And are your periods normally regular? Any issues during them?
Normally regular, no issues.
Okay. Are you sexually active? And if so, how many sexual partners do you have?
Yes, I'm sexually active. I have a boyfriend, so just
Okay.
one.
Has anyone in your family had a history of cervical cancer?
I'm not sure. Mom, didn't one of our relatives have cervical cancer?
Yes, unfortunately my mother passed away from cervical cancer. However, she rarely went to get her pap smears done, and unfortunately it was detected at a very advanced stage. This is why I think it is important to stay on top of health screenings and preventative measures.
Yes, it is great that you are staying on top of your health screenings. Okay, last question. Do you have any allergies we should be aware of and any current medications you're on?
I have no allergies. I'm currently on birth control called Lolestrin.
Okay, and how long have you been on this birth control?
3 years.
Okay, great. I'm gonna step out now and our PA will be in shortly and she can answer any questions that you have.
Okay, great.
Okay.
Action.
Knock knock. Hi Katie.
Hi.
I'm Jen. I'm one of the PAs. This is Jamie. She's a PA student shadowing me today.
Hi, nice to meet you. I'll be here to learn and support today.
Is it okay for her to observe?
Yeah, that's fine.
Thanks for coming in today. Are you here for your first annual visit?
Yeah, and I'm kind of nervous about it.
That's really normal and understandable. My goal through all of this is to explain exactly what it is, why we do it, and make sure you feel comfortable every step of today's visit.
Yeah, she's been putting this off a little bit. I told her that when I was her age, we didn't even have the HPV vaccine, and she's lucky to have this test.
Absolutely, you're both right. This is a chance to take control of your health and maintain your wellness. Mom, do you mind if you step out of the room for me?
Of course not.
So one of the parts of today's visit is going to include a pap smear. A pap smear is a screening test for cervical cancer. We collect a few cells from your cervix, the lower part of your uterus, and then we're going to send them off to the lab and they're going to check it under the microscope.
So it's checking if I have cancer.
Not exactly. The goal is to catch cell changes long before they become cancer. Almost all cervical cancers are caused by HPV, which is a common virus. Most HPV infections clear on their own, especially in women under 30, but sometimes if HPV lingers, abnormal cells can form. Since pap smears were introduced, cervical cancer rates in the US have dropped by more than 50% when women stay on schedule like you are.
Action.
So why do I need it now at 22?
That's a great question. Guidelines recommend that all women start pap smears at age of 21 regardless of sexual history.
So why do we wait until 21 even if someone is sexually active earlier?
That's because cervical cancer is rare under 21, but starting pap smears at 21 allows us to detect early changes if they occur.
So just one test every 3 years until I'm 30.
Exactly.
So I'm kind of nervous about the test itself, so what happens?
That's totally fair. Here is the step-by-step. You're gonna change into a gown and you're gonna lie back on the exam table. I'm gonna use a really small device called a speculum to gently open the vagina. It may feel a little pressure, but it shouldn't be painful. Then I'll use a soft brush to collect some of the cells inside of the cervix, and that's it. It takes under 5 minutes.
Okay, that doesn't sound as bad as I thought.
Yeah, and we'll also make sure that you're covered the entire time, explain each step as we go, and communicate the entire time. So if you just tell me if you need to pause. Communication is just as important as the test itself.
And what if the test comes back abnormal?
Most of the time, abnormal means mild changes, often from HPV, and most of those resolve on their own. We'd repeat the test sooner to do a closer look with a colposcopy. Very rarely does it mean cancer.
And if the test comes back as normal?
Then we'll just keep evaluating you every year.
What if I already got the HPV vaccine?
That's great. The vaccine protects against most dangerous HPV types, but not all of them, and that's why pap smears are still really important, even if you're vaccinated. All right, do you have any more questions? Are you ready to start?
Yeah, I'm ready to go.
Okay.
Hello, I'm a representative from the lab. I wanted to call to let you know Katie Bill's pap smear came back abnormal. Can I fax you the results?
Thanks for letting me know. Yes, please. Okay, I'm gonna call the patient now and we'll let her know the results.
Okay, I'll observe closely to learn how you communicate the results with sensitivity and support.
Hi, Katie. How are you doing today? Thanks so much for waiting. So we got the results from your recent pap smear. The pap test didn't show cancer, but the lab did find HPV, specifically a high-risk strain in your cervical sample. This means that there's an increased risk of abnormal changes in your cervical cells over time if we don't monitor closely, but it does not mean that you have cancer right now. Most HPV infections resolve or never cause damage. Because of your family history, we're going to be extra vigilant. To help explain, I've asked Dr. Fontix, the collaborating physician, to join us for a moment.
Hi Katie, hi Ms. Bill, how are you doing today? I'm Dr. Fontix. I wanted to keep this clear and reassuring. Finding HPV doesn't mean something terrible has happened. It simply tells us we need to keep a closer look on things moving forward. First, we may do a colposcopy next. That's where we take a closer look at your cervix with magnification and possibly a biopsy of any areas that look abnormal. Second, we'll base our timing on your cytology results. If the cytology is normal, sometimes we repeat testing in 12 months. If the cytology shows mild abnormalities, we'll act sooner. We'll emphasize your follow-up schedule because staying on schedule is especially important with the family history we know. The goal is early detection and intervention, catching changes before they become serious. You're not alone in this, Katie. We'll guide you step by step.
Okay, I'll go ahead and arrange for the colposcopy consult and set up a follow-up schedule. You're doing the right things by coming in. I really want you to think of this as a part of your overall women's health maintenance. Just like we check blood pressure or cholesterol, pap smears are preventative care. They're all about catching things early and just keeping you healthy.
Thanks for calling with my results. I feel a lot better now.
I'm glad too. This is you taking control of your health, and if you ever have questions about pap smears, birth control, or any women's health concerns, that's what we're here for.
One.
So overall from this presentation, you have learned that pap smears are effective cervical cancer screening tools. They significantly reduce the death rate through early detection of abnormal cells. Guidelines recommend a pap smear every 3 years for ages 21 to 29, or every 5 years for 29 to 65. Most cervical cancers, about 99 to 100%, are caused by the human papillomavirus, or HPV. And successful treatment of precancerous cells identified by pap smears prevent cervical cancer in most people. So hopefully this inspires you to get tested and get a pap smear and I hope you enjoyed our presentation.